As we age, our bodies change, and it's not always for the better. Dryness, pelvic pain, bladder issues can affect many women, but a new procedure can help. Here to tell us more is Dr. Russell Bartels with Scottsdale Center for Women's Health. Great to see you.
It's good to see you again. Usually I'm talking about hormones, and today I'm going to talk about some very exciting procedures for women's health, two of the most sought-after procedures now for women's health. For a long time, there's been a lot of focus on men's sexual health, and the women have been kind of left out of that game. And now we can even the playing field, or maybe even exceed the playing field in the sense that we have great solutions for vaginal dryness, leaky bladders, vaginal laxity. As a board-certified gynecologist here for 14 years, these are issues I hear about day in, day out. And now there have always been some good solutions, but now we have great solutions that don't require surgery. We still do procedures to tighten the vaginas, to support the bladders for leaky bladder problems, but those come with considerable downtime and potential complications. Great procedures, but now we have great alternatives for someone who says, I have these problems, vaginal dryness, leaky bladder. I wouldn't mind if the vagina was a little more snug, and we can do this in an office procedure called FemiLift, and it is basically a zero downtime procedure, and those are easy words to say, but this is so true when it comes to this procedure. 5 minutes of this procedure where we place a laser in the vagina. Most women are comfortable with a vaginal ultrasound. It's a very similar procedure where we place a probe vaginally, and really in 5 minutes with no anesthesia, you're off the table, and we'll repeat it again in a month and again in 2 months for the complete series.
So there's 3 treatments overall with the FemiLift.
3 treatments. If a 4th is needed, we can do that. As far as the results go for, say, a leaky bladder, we might need to see some time go by, because what we're doing with this laser is we're actually creating a healing process. The laser creates a micro injury, and then the healing cascade comes in and regenerates the tissue to create a more plush vaginal lining, which is more reminiscent of when you were younger, and there's more secretions, and it's a more youthful vaginal environment.
And who's a good candidate for this procedure?
Most of the candidates for the procedure, which was designed for vaginal dryness and painful intercourse, are going to be more of the menopausal women. Maybe they can't take hormones. Cancer survivors are great for this procedure because there's an answer for them now. But anyone who wants to have the bladder leaking problem addressed, or the vaginal tightening, it doesn't matter the age, it's more about treating the symptom. And there are times where we will combine that FemiLift procedure with the O-shot, which is platelet-rich plasma injected into the bladder area in the vagina, around the clitoris, very painless. We use a little anesthesia for that, a little topical. Painless procedure as a standalone for increased orgasm and sexual sensitivity, as well as to help with the leaky bladder and even overactive bladder.
And explain what PRP is for people at home that may not know. This is actually using your own blood.
Right,
platelets.
we draw the patient's blood. Okay, it takes 15 minutes to prepare it in a centrifuge, and it separates out the red cells and the platelet-rich plasma. It's this gold serum, which is just fantastic for rejuvenating joints as well as function, okay, in the vagina, the nerves, the blood flow. It's a well-recognized therapeutic these days with almost magical properties.
And selecting a doctor for any of these procedures is very important.
Yes.
How should people go about doing that? What should they look for?
You want somebody with experience in these types of procedures, using the proper technique, the proper supplies, the PRP kits. You want an FDA-approved kit. You don't want a knockoff kit. You want somebody who knows how to inject into the right areas, which are critical.
Yes, please.
Yes, and to do this in a very comfortable manner, and someone, most importantly, with experience in these areas.
Is there any risk with either of these procedures?
Unbelievable. Virtually no risk. In over about 10,000 of these O-shot procedures, there have been no reports of any prolonged problems, maybe a little temporary discomfort, but all very safe, very effective. The FemiLift procedure, these are just unbelievably safe and effective. No downtime, no risk, with great success. I'm so excited to talk about these procedures because they are so simple and effective and really solve a lot of problems that I hear day in, day out.
Right, you've seen a lot of change in your industry, I'm sure, over those last years that you've been involved. Tell me about your special offer that you have right now in the FemiLift.
Well, we're very excited about it. We want to get more patients in experiencing this, so we're doing $500 off for the first 20 callers. So get that call going and set up a consultation. If you've done your homework and you know that you want the O shot, just let them know when you call, and we can do it that day that you come in. It's a very simple procedure. Like I said, you'll be in and out probably in a half an hour, and no restrictions.
All right, Dr. Bartels, thank you so much.
Thank you.
And if you'd like more information on Scottsdale Center for Women's Health, visit their website, scottsdaleobgyn.com, or call the number you see on your screen.